If you've had a bone or a joint problem, chances are that you've probably visited one of New England Orthopedic Surgeons' 14 excellent surgeons, and they can help with orthopedic problems from head to toe. We met with Dr. Jacqueline van der Zanden about problems that can arise in our hands. Dr. van der Zanden, everyone who comes through these doors and works with you has gone through a fellowship program. If you wouldn't mind, tell us about that fellowship program.
Sure. Well, fellowship's an additional training that we do after orthopedic residency. The residency is what we do to learn about the basic care of bone and joint diseases and injuries, and the fellowship is some additional training we do so we can subspecialize in particular fields of interest. For me, that's hand and wrist. Some of my colleagues have done fellowships in spine, sports, foot and ankle. It allows us to focus on what we like to treat.
So you've picked the hand and wrist. Now I'm interested to know, because we use our hands and our wrists every day. It's probably the thing that we use most besides our brain, I think you could argue. Who runs into more trouble, children or adults?
Actually, I think one of the things that interests me about hand surgery is that I get to treat a whole cross-section of people. Most people have hands, most people have two hands.
That's true.
And everybody works with them at work, at play, work at home. There's people are always using their hands, and it's always interesting the number of people who are in a cast who say you don't realize how much you use your hands until they're not available to use. And so yeah, I get to treat a lot of injuries to the hand. I actually think that it's hard to say whether adults or children get injured more frequently. Children have the benefit of youth and growth on their side, so sometimes their injuries are a little easier to treat, and I'm generalizing here, but they do tend to heal maybe a little quicker, and as I said, they have the benefit of growth on their side. Some adult injuries, a lot of them can be treated non-operatively, but sometimes we do need to treat these with surgery, and we have different opportunities to treat those as needed.
Now, adults have to deal with a lot more too than the fractures and the breaks. They have to deal with things like arthritis. How do you treat arthritis?
So arthritis, similar to arthritis in the bigger joints of the body, the hips and the knees, arthritis in the small bones is similar. It's the same process, wear and tear of the cartilage. Sometimes it'll affect one joint, and sometimes it'll affect multiple joints in the hand. The most common area is actually the base of the thumb. Affects people usually over the age of 50, sometimes women a little more commonly than men. We start with treating it conservatively with anti-inflammatory medications, splinting, activity modifications, and then there are some surgical treatments as well. There's some very reliable surgeries that we can do to help deal with arthritis in the hands and the wrist.
Now, adults also face carpal tunnel syndrome too. Take us through what it is and how you help to stem the tide of it.
Sure. Carpal tunnel is a very common problem. This is basically a compression of a nerve that travels through the wrist, and it comes down the neck, comes down the arm, and comes out to the fingers, giving sensation to some of the fingers and motor function as well. It gets subjected to some compression due either to increased swelling or can be related to trauma. Usually in most people we actually don't know the reason, and we call it idiopathic because we don't know for sure why it happens. A lot of people feel it's related to repetitive activities which are common at work. Patients will first complain of numbness, frequently affecting the hands at night, waking up with the hands feeling like they're falling asleep. First line of treatment for that is actually a splint, and that can relieve the symptoms at night pretty reliably. If that starts not being as effective at controlling the symptoms, we have other conservative options, including a steroid injection, which can be done in the office. This can give pretty good relief, and it gives us some good information about who might do well to need carpal tunnel release in the future. That is a surgery. It's done as an outpatient. Come in, go out the same day, and you release the pressure on that nerve. So that gives the nerve a little more breathing room.
Now, if people come in here to your office, you can help them with so many different situations. But preventative care is something that you can't help people with. It's something that they have to do at home. What are some things that people can do to keep their hands and wrists safe from not only fractures and breaks, but also from carpal tunnel and from other problems?
A lot of those things are sort of just being aware of what's giving you problems. If you notice certain activities bother you, maybe changing the way that you're using the hands, and even also the bigger joints of the body can help, so you're not, you're lifting with proper technique, things like that can avoid putting stress on the smaller joints. And if you notice that, especially with like the nerve compression thing, sometimes staying on the phone with the elbow bent for a long time can cause compression of a nerve around the elbow. Changing the hand that you're using the phone with, using a hands-free device sometimes can help with that. If you find that the hands go numb when you're driving, changing the position of the hand on the steering wheel, simple things like that can actually be make a good impact.
You just have to be aware, I guess.
Yeah.
Well, I know you're probably sick of these, but thank you so much for joining us today. I guess I'll
you.
give you one more.
Thanks for having me.
For more information about New England Orthopedic Surgeons, you can visit them on 30 Burney Avenue in Springfield. Give them a call, 413-785-4666, or just visit their website, neortho.com.